This is me, Steve Taylor. I've been a GP now for 27 years and a doctor for over 30. I qualified in 1989 from Manchester Medical School and back then went on to hospital jobs like we all do. Some of those jobs involved doing 90 to 120 hours a week. Back then there were a lot of beds in hospital, but they've fallen dramatically since then, from nearly 300,000 to just over 150,000. Length of hospital stays has fallen from 8.4 days to 4.5, and what that's meant is that actually a number of those conditions that were cared for in hospital are now being cared for in the community, and as doctors we've been picking that up. Prescribing has gone up dramatically over the years. When I started, 20% of my practice population were on some sort of medication. Now it's 50%. And of those 50%, some of them are very complex and rising to nearly 95% of patients over the age of 85 on multiple medications. And mental health has been a significant increase over the years. It probably takes up 20 to 30% of my workload, and we can see there's been increasing prescribing over that period of time as well. Life expectancy's risen as well, which is good, but actually has meant more patients. And there's been a huge rise in waiting lists, particularly over the last 12 months due to COVID. But the doctors' numbers have remained dramatically stable, which has meant that we've all become increasingly stressed. There's been mixed messages from a number of places like NHS England. We've had increased regulation from the CQC. We have to record an awful lot more, and our records are always scrutinised. We're also doing a lot more work when it comes to looking after people. I want to say that there's a lot of work done in general practice, so look after us.